This checklist incorporates caring for a person with diabetes. Students will be required to provide nursing care for 2 people who suffer from diabetes, one of which will have hypoglycemia, so a blood sugar that's less than 4 millimoles per litre, and a patient with hyperglycemia, which is a blood glucose level above 8. Um, the third option is if the opportunity arises for one of the person with hypoglycemia who may have signs of ketoacidosis. So we've basically separated into 2 patients and 2 attempts opportunities arise for both of those patients. So it's basically about obviously measuring and interpreting the blood glucose levels appropriately and then communicating the findings so that the intervention that you did as a result of what you found was that blood sugar was low, and what did you do about it? Same with if the patient's blood sugar is elevated, what was the management that you undertook? Was it appropriate? Did you identify that there was an abnormality and that it needed to be treated appropriately? If the opportunity arises and there is a patient that has ketoacidosis, we want you to we want that to be documented here. If not, then we will simulate that in the simulation lab when you return from placement. And also a little bit around education after you've managed the situation, how you explain that to the patient. Was that appropriate? As normal, the feedback will be provided by the supervisor, and then you will have an opportunity to respond to that feedback. Then the next section, we have a reflection based on both the hypoglycemic patient with the sugar less than 4 and the hyperglycemic patient with the blood glucose above 8. Okay, so we want, in the reflection, we want you to describe what the patient's signs and symptoms look like, how they presented to you. Were they sweaty? Were they, did they seem clammy? Those kinds of things. We want you to provide some information relating to the blood glucose and any abnormalities related to a urine or pathology that was taken. We want you to describe the current regime that patient was on for their diabetes, so the medications that they're on, the frequency that they have their blood glucose measured, those kinds of things. We also want you to explain some self-management strategies that you may have discussed or implemented for this person, or if not, some suggestions that, perhaps in the future that this person you might recommend to them. We want to know what nursing care you provided, how you managed the situation in both this one, the hypoglycemic patient and the hyperglycemic patient, so they're both the same applies. So that's it for cluster 5.